Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before I begin, I'd like to introduce the Minister of Health and Wellness, Randy Delory, and he'll say a few words, and then we'll take some questions. Go ahead, Minister.
Thank you, Chrissy. Good afternoon. Today I'm announcing the details of a review of the COVID-19 outbreak at the Northwood Halifax campus. It's been a difficult time in our province these last few months. This has been acutely felt at Northwood, where 53 residents of Northwood died as a result of COVID-19. Like all Nova Scotians, we are very concerned and saddened about what happened there. We want answers for the families and friends who lost loved ones from this terrible virus, and indeed for all Nova Scotians. That's why today I'm announcing the appointment of a Quality Improvement Committee to review the COVID-19 outbreak at Northwood. Infectious disease consultant Dr. Chris Latta and former British Columbia Associate Deputy Minister of Health Dr. Lynn Stevenson will analyze the outbreak and the response to determine what factors contributed to the spread of COVID-19 at Northwood. This review is being done under the Quality Improvement Information Protection Act. It will consider several things, including whether the preparedness for and the response to COVID-19 infections were appropriate and timely during each stage of the outbreak. This will be revealed through interviews with staff, physicians, administrators, families, and others. It will look at staff scheduling, practices, and processes, and it will consider best practices in effectively controlling and preventing the introduction and the spread of COVID-19 in long-term care settings. Government is also doing a separate internal review of broader infection prevention and control within the long-term care sector. This review will consider overall infection prevention and control practices in long-term care facilities and review actions taken during the first wave of COVID-19 in Nova Scotia long-term care facilities. Both reviews will make recommendations to help avoid and contain future outbreaks, and will help Northwood and other long-term care facilities better prepare for future waves of this virus. I know that Northwood and NSHA are both supportive of these efforts and will be full participants, and I thank them for that. The recommendations will be delivered to me by the end of September and will be made public after the review period. The outbreak at Northwood was a considerable challenge for all involved. The residents, their families, and staff, including administration. I want to thank all those at Northwood and everyone from other partner organizations that stepped up, like the Nova Scotia Health Authority, the IWK, VON, EHS, other facilities, unions and their members, Dalhousie medical students, home care providers, and the many others who stepped up to help respond to COVID-19 in our long-term care facilities, including Northwood. Across Nova Scotia, Canada, and around the world, we continue to learn how to best manage COVID-19. These reviews will help us learn more to ensure Northwood, other long-term care facilities, and our health system are better prepared for future waves of COVID-19. Thank you. Now I'll turn it over to Chrissy. Some questions.
Questions. Just a reminder, one question and one follow-up for reporters on the line in the amount of time that we have allocated for today. First question will go to Shayna Luck with CBC.
Good afternoon. A question about how families are supposed to weigh in on this review. Should they be waiting to be contacted, or will they be putting their hands up? How should they put forward their comments?
Thank you for the question. Family participation is, I think, important, but the independence of the committee members will work to establish the process by which they engage family members and others throughout the review process. So we're just announcing this, and the work will get underway, and the committee members will initiate the process and communicate how they will connect with family members and the others as they conduct their review.
Shana, do you have a follow-up?
Yes. How quickly do you commit to putting money behind those recommendations that you accept? Are we talking about there will be funding for those moves in September or within the next budget year? What is your timeline on that?
So we've already taken action and put money behind our supports within the long-term care and the acute and primary care health systems as part of our response to COVID-19. We've made decisions, made changes in policies and processes that aligned with the information that we received to move forward. I think our track record in investing and responding to the expert panel review on long-term care also shows that we will take the appropriate action and make the necessary investments in as timely a fashion as possible.
Next question will go to Alicia Draus with Global.
Thank you. I'm just wondering why the decision was made to do this under the Quality Improvement Information Protection Act versus doing a public inquiry, which is what many were calling for.
So this process that's enabled under this piece of legislation allows us to get the review initiated and completed in a very timely fashion. It's also a framework for these types of reviews to provide quality improvement recommendations within healthcare systems. Frameworks like this exist in many jurisdictions across the country. It's well known, so to get the experts on our panel and to get them to work as soon as possible, this was considered the best process to do that.
Alicia, do you have a follow-up?
I do, and this is just in terms of making the recommendations public. Why only making the recommendations public and not making some of the actual findings as to what happened public?
Within the legislation governing the quality improvement reviews, it has a number of provisions to protect personal health information of people that may be part of the review, as well as, I don't know if, for the lack of better words, kind of like whistleblower type of protections, so that there would be no actions taken against individuals who would be providing information to the committee members conducting the review and making the recommendations. So there are limitations in terms of the scope of information that can be made public. And again, the focal point here is the recommendations, because those are the recommendations that will lead us to make changes and improvements to our long-term care sector to help us avoid and minimize infections from COVID and potentially other diseases in the future.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Following up on why this is a review and not a public inquiry, I understand that this is being done quickly to use the lessons in advance of a second wave, but why not also launch a longer-term public inquiry?
So for me, my focus in the role with health and our department's focus, and I think the sector's is, we know, as Dr. Strang has highlighted numerous times, that the virus isn't gone, and we anticipate further waves throughout Canada and in Nova Scotia, and we want to make sure that our system is as prepared as possible. This review process that we've established with these experts on the committee to conduct the review and make recommendations in a very tight period is where we're going to be focusing, so that we can, as a system, make changes to best position us to protect our loved ones in long-term care in the province from future waves of COVID.
Lindsay, do you have a follow-up?
Yes, thank you. I understand that, and using those recommendations quickly makes sense. What's stopping you then from also launching a public inquiry, which would be in addition to what you're doing with this review?
So while this review is ongoing, we'll see what path the recommendations take. Again, I think we want to focus our attention and efforts to get these answers. The people who would be participating to provide information, including staff and family members, administration, and others who would have the information that can help inform the committee members to understand what transpired and what, if any, improvements to those actions could be taken. So they will be focused, and I think we want the people who are providing the information to be focused on this review. That includes the people who are providing the information so that we can get to the recommendations which would inform our future actions to support our long-term care sector rather than dividing attention through multiple reviews simultaneously.
Next question will go to Natasha Pace with CTV.
Thank you. Is there anything under the Quality Improvement Information Protection Act in this review you're doing that would prevent you from calling a full public inquiry or the medical examiner from calling a fatality inquiry after this review is complete and the recommendations are handed to your office in September?
I believe those are two separate pieces of legislation, so I don't believe that there's any restrictions from the quality review process and public inquiries.
Natasha, do you have a follow-up?
I do. You mentioned that, Dr. Strang and everyone knows this virus isn't gone yet, and you are anticipating further waves of COVID-19. I'm wondering whether or not you're prepared or your government is prepared to make a commitment to have single occupancy rooms in long-term care facilities. That was one of the main issues a lot of people brought up with how fast this spread at Northwood. Given the fact this review is going to take place over the summer, you're not going to be getting the recommendations till the middle of September, which is when we're expecting a second wave. Is there anything that's being done to eliminate it being double or triple occupancy in these seniors' homes?
So one of the things that took place during the first wave in our long-term care sectors, we did provide provisions, including at Northwood, to allow facilities to carry vacancies to some degree, which provides them the flexibility should an outbreak occur to facilitate isolation of the infected residents and respond to the outbreak. So we've been running our system below capacity to support the facilities in the response and their ability to respond already. And with Northwood, we've committed to continue to support them and their vacancies while this review is being conducted, and we'll see what recommendations come from the committee members when the review is completed as it relates to the topic of room configurations.
Next question will go to John McPhee with the Chronicle Herald. John, are you on the line? Next, we'll go to Cassandra Nadeau-Lomarche with Radio Canada.
Thank you, Misty. My question is, how do you expect to be able to implement any change coming from the recommendations before a possible second wave that was going to happen sooner than later, if it happens?
So we certainly are, from a public health perspective, building and preparing and anticipating a potential for a second wave in Nova Scotia and I think across the world. As it relates to our investments and responses and our agility in Nova Scotia to respond, I think we saw that during the first wave. As we learned more about the virus, public health directives and recommendations that came forward, we responded to, made the investments, whether that's around personal protective equipment, PPE, or as I mentioned in a previous response, as it relates to occupancy rates within facilities. We've been listening in particular to our infection prevention control and public health experts to guide our response, and I think our system and government government has responded based upon that advice in quite timely fashion. So I think again. It's too early to presuppose what the nature of the recommendations will be, but for those recommendations that we're able to implement in a timely fashion, we'll certainly be endeavoring to do that.
Cassandra, do you have a follow-up?
Yes, I'm just looking for comment on the failure to follow safety guidelines at Lockview High School graduate ceremony, and also what the government can do to ensure that these types of situations don't happen again.
So as it relates to, it's a bit outside of the long-term care, but as it relates to the graduating ceremonies, the public health order, which is available online, does provide specific guidelines for any community groups or organizations that planned to bring together a community celebration of graduates. This is a very special time in their lives. We recognize that. But we also, and Dr. Strang and the public health team, put a lot of work in with the Department of Education to establish some guidelines for community members who wanted to do something beyond what each of the individual schools did for a recognition and a celebration. So those guidelines are very clear. We expect all community groups, parents and others, to certainly set a good example for their children by becoming informed. The information is all available on our website at novascotia.ca/coronavirus. That'll take you to the order and the information that you need if you're organizing one of these events. And we certainly are disappointed with reports that at a particular site that this order was not necessarily adhered to in its entirety. But I want to remind all Nova Scotians, not just graduates and those organizing these graduation ceremonies, of the importance of continuing to adhere to the advice and, in particular, the directives that have come from our public health office. This is being done to protect all Nova Scotians. We're here today in response to a very serious situation that took place and cost the lives of 53 Nova Scotians. That's 53 families who are mourning a loved one because of this disease. It's incumbent upon all Nova Scotians to do our part to minimize the risk of spread throughout our province, because the less the virus is outside in our province and our communities, the lower the chances that it would ever make its way into one of our long-term care facilities. So again, I just want to remind all Nova Scotians of that importance, and that's our expectation.
I'm going to go back to John McPhee with the Chronicle Herald. John, are you on the line? Okay, moving on to Jennifer Henderson with the Halifax Examiner.
Good afternoon, Minister. Can you tell us how much money over the next 3 months before the report recommendations come down the government is planning to spend to hire more staff at Northwood, considering that both the Chief Medical Officer of Public Health, management there, and infection control specialists have all said publicly that the virus was brought in by staff, and it spread in part because staff were unable to stay on one floor or stay only with infected residents. Essentially, there wasn't sufficient staff to allow the facility to keep staff in one designated area. So this knowledge is already out there. It's been stated. Are you planning to spend any money in the next 3 months to hire additional people?
So one of the things that has been done in particular at Northwood is the allowance of a number of vacancies within their facility. That without changing the staffing complement. So the effective result of that is an increase of staff available to support the needs of the remaining residents within the facility. So again, as I've mentioned, at Northwood and other facilities, we are supporting the increased the relative ratio of staffing to residents by virtue of maintaining some vacancies in those facilities to allow them to respond to patient needs as well as potential future COVID infection at any of those facilities.
Jennifer, do you have a follow-up?
Yes, I'm just curious, since Minister, since it was the government's decision to proceed with a review under this act instead of the Inquiries Act, I'd like to know whether the class action lawsuit that's been proposed on behalf of some families of Northwood residents was a factor in the government's decision to choose this type of review as opposed to a public inquiry.
As I've said before, the reason for establishing this review under the quality improvement process legislation is that it's an existing framework that is really the foundation of reviews in the healthcare sector. It's one that the experts would be familiar with, that allows for the most expeditious review and delivery of the information and the recommendations to us as government so that it allows us to then begin taking actions on those recommendations. As we all know, a second wave is expected to come. Many public health experts associate it with flu season, which would be in the fall. So that's why the timelines on the review are fairly aggressive, but our committee members recognize and are committed to getting that work done so that we can all proceed to take the necessary steps to improve the preparation for a future wave.
Next question will go to Mike Tutton with the Canadian Press.
Minister, Nova Scotia is part of what many have characterized as a national failure through its long-term care system, given the double the rate of deaths over OECD neighbors during the COVID-19 pandemic so far. And although this is a step to look at one facility, would you commit to a deeper probe, public inquiry, to consider the deeper issues that exist, whether it's staffing, the lack of single rooms and facilities, and a number of other deep-rooted problems that were exposed by COVID-19 in the form of a wider public inquiry through the fall? Or will this very limited review suffice?
So a couple of things in response. The first is when you look at Nova Scotia as a province and our entire impact across long-term care facilities, we have just under 140 long-term care facilities, and we had either staff or residents infected that are associated with about 9 or 10 of those 140 facilities. Within the sphere of that, by and large, whether it was a staff person or a resident who was infected at those facilities, the steps that were taken by the facility and the health system to support them during the outbreak at their facility, the virus was contained and did not broadly spread. The one exception to that was our Northwood facility, and we've seen the devastating results that can occur if the virus spreads. So to that end, I wouldn't characterize our long-term care system as a whole as a failure, but we do recognize that the issue and the risks associated with this particular virus, we did see it unfold at the Northwood facility. And that's why this quality improvement review is focused on Northwood, because that is the one facility, despite having the same provincial policies, procedures that we established going through COVID across the sector. That's one facility where we had the broadest spread. So we want to understand and take the lessons from that can apply to the entire sector, because we did have it, the virus enter 9 or 10 other facilities that we want to prevent it from entering in the future. And again, we want to also learn and minimize the spread once it does enter a facility. The other piece in response to your question is that we are conducting, as I've mentioned in my opening remarks, we're also conducting a broader system-wide infection prevention control review within our long-term care sector. So that is that broader review throughout the system to help inform actions as well.
Mike, do you have a follow-up?
Yes. The Northwood itself has asked for funding repeatedly to expand. One of the last proposals was to add 3 floors, I believe. Would your department even start on any of those ideas of expanding it prior to the recommendations, or will the recommendations of this review be key as to what you do with Northwood going forward?
Thanks. I suspect recommendations will certainly be important because one of the when in my response to the previous question, I noted that Northwood stands out as the one facility out of almost 140 in the province that not only did the COVID-19 virus get introduced, but spread and had devastating impacts. One of the other things that stands out about that Northwood Halifax campus is the size of the facility. So, I think the Premier's spoken about this in the past in his daily updates as well. Is that a variable? And we don't know the answer to that question. So I think it would be a little too early to commit to expanding an already large facility before we do get those recommendations. Now, that said, as was the case when the formal, I think to the degree there was a bit of a formal submission in the fall, discussions have been ongoing and I think continue. The last discussions I recall staff having with Northwood were during the month of June, earlier this month, on that very specific topic.
Next question will go to Chris Halef with News 95.7. Chris, are you on the line? And that's all the questions that we have for today.
Thank you.